How to become a nurse in Belgium. There are two type of nurses. There is one, the higher one. That one is called the A1 of the RN nurses. Those ones they have the BSc or bachelor's degree in nursing, like they went to the university or higher institution to become a nurse. Before, this course was 3 years. When you go for this BSc in nursing before, it was 3 years, but for the past 4 years or 5 years, I think it was changed drastically. It now takes 4 years to study and become a BSc holder in nursing. That's one. The other option is to become an A2 nurse, or the what is popularly called the R2 verpleegkundige. These are the nurses that this is actually a post-secondary school graduate program. It's not a higher institution, or they went to the College of Nursing, if I can compare it to the African system, yeah, to become a nurse. So there are two type of nurses in Belgium. The basic nurses in Belgium. There is the A1 or the R1 verpleegkundige. There is the A2 nurses or the R2 verpleegkundige in Belgium. Yeah. The difference, there is quite a big difference in pay, and there is also quite a big difference in theory, the length of theory that you are taught. But both the A1 nurse or the R1 verpleegkundige and the A2 nurse or the R2 verpleegkundige are both registered nurses. You getting it? They are both registered nurses, and they both received or allowed or they both have the license to practice. So when you go for 4 years course and you become a BSc holder in nursing, that's the A1 or the RN, or you go for a post-secondary school college of nursing course and you become a post-secondary school holder of nursing degree holder in Belgium, you are both registered nurses. You have to go through a process, ask for your license, your visa, like we call it here. You receive your license or your visa to practice. So you are both nurses, you are both official nurses. Of course, in payment grade, there's a big difference, you understand, and in recognition wise there is also a big difference, you get. But practical wise, the basic nurses I'm talking about, practical wise, they both actually learn the same thing, you get. The both practical wise, they learn the same thing. It's like the A1 nurse is taught how to treat a patient in a certain way. The A2 nurse or the R2 is also taught how to treat a patient in a certain way. Like practically, they are taught the same thing throughout the course of throughout the duration of the whole school or the whole school course, you get. But afterwards, after they both get the degree, you understand, the department they are both allowed to work in is definitely different. Their A1 can work in practically all the departments, and A2 is actually quite a bit limited in the department of the health sector they can work in, you get. And another criteria is how to get in both of this nursing program is also very different. Yeah, like to get in the A1, the bachelor's degree or the RN verpleegkundige nursing program, you have to have a secondary school certificate to get in. Once you have a secondary school certificate, you can get in. But to get in the A2 nursing program, the R2, you don't need a secondary school certificate. You just need to be 18 years of age and you can get in. Of course, there are other criteria in order for you to be allowed in, but it's that way. Another thing, major transition that is currently going on, that is also what I did, is that I was an A2 nurse for years. I practiced for 7 years. After practicing for 7 years, I went back to get my BSc in nursing. That's my bachelor's degree in nursing. You understand? So I was an A2, practiced for 7 years, went back for 3 years degree course to get my BSc or bachelor's degree in nursing. So if you have any questions, just ask me. Thanks for listening.